Let's listen to an expert doctor, Kumar Abhinav, consultant general physician and diabetologist with experience of 10 years. Currently at ISWP Hospital, Jamshedpur, as Senior Manager, Medical Services for Hypertension in Young Population, along with coronary artery disease and higher heart rate, can be sure of happy heart. Doctor, how do we define hypertension and when should we conclude that the person has hypertension?
See, blood pressure is something which the flowing blood puts on the lateral walls of our artery. Supposedly, one pipe is there. In that pipe, the water is flowing. The water that is flowing, it puts a pressure on the pipe. So similarly, the blood flowing, it puts a pressure on the blood vessels. That collateral pressure that the blood pushes onto the blood vessels is known as blood pressure. Now coming down to hypertension. Hypertension is a disorder which in common language is known as high BP, high blood pressure. The blood pressure has two components, systolic blood pressure and the diastolic blood pressure. So if the systolic blood pressure remains higher than 140 mm of mercury and the diastolic pressure remains higher than the 90 mm of mercury over 3 consecutive readings in a patient, then we define it as hypertension.
Doctor, can high blood pressure be completely cured?
Well, heart rate has a lot of relevance in hypertension, to be very frank. See, to be very frank, let me tell you that if a person is having a higher heart rate, that means his heart is overworked. Plus, he is having hypertension. So, you can understand once already your heart is overworked, then there is burden of hypertension. So definitely heart rate has a relevance, and when we treat hypertension, we take into consideration the blood pressure as well as the heart rate of the patient, and then we determine the therapy, antihypertensive therapy for that. So heart rate definitely plays a very important role in the management of hypertension.
Doctor, has there been a recent increase in the incidence of hypertension and heart attack among young patients? If yes, what could be the underlying cause?
Yeah, to be very frank, all the lifestyle disorders like hypertension, diabetes, cardiothoracic diseases, apart from medicines, the lifestyle modifications do play a very significant part. It's not like that if I am hypertensive and I am taking my antihypertensive medications, then I can eat everything, I can do anything I want. No, it's not like that. 50% the medicine works, 50% the patient's own, precautions count for. So, if you talk to me regarding hypertension, the first and foremost thing that I should recommend and that I always recommend to my patients is to cut down on the salt intake. In Asian diet, unfortunately, in the Asian diet and unfortunately in our Indian diet, the salt intake is very much high compared to the Western world and the European world. So the first and foremost thing, the precautions, which if you ask me that I should say, is the patient should cut down on the salt intake. Apart from that, having a plain diet, less of spices, less of oils would be much better. Having a continental organic diet will be very much well suited for a hypertensive patient.
Public awareness initiative by Glenmark Pharmaceutical.